The Perlman Laboratory focuses on precision medicine. Precision medicine means that we try to tailor-make each drug for each patient. The problem nowadays is that we have many therapeutics, but the issue is that each therapeutic is not made for an individual, and they're made for a common group here. The goal is to identify different genomic sequences or functional data to actually say, this patient, you get this drug, and they'll respond to that drug. So the Perlman Laboratory was one of the first labs to identify macrophages as being the central important cells in rheumatoid arthritis and now in systemic sclerosis. We showed that if you actually target these macrophage populations, you can treat the disease. Previous studies have showed that macrophages, if you reduce their numbers, that correlates directly with response. So the idea here is to identify different macrophage populations that change during disease, so therefore we can then predict which patients will respond to a therapeutic and which ones will fail a therapeutic. When I became chief 9 years ago, one of our major goals was to set up a biorepository for rheumatic disease. Before, we did not have any infrastructure to help set this aside. Now, 9 years later, we now have tissue banked from patients with rheumatoid arthritis using our ultrasound-guided synovial biopsy program, which we're the largest in the country. We now have blood and serum banked from these same patients. We now have tissue, meaning lung cells from patients with scleroderma. We have skin, esophageal biopsies, and blood banked from all of our scleroderma patients that undergo an EGD. We now collect synovial fluid from also our rheumatoid arthritis patients. We also collect spinal fluid and peripheral blood from our lupus patients, and now we're collecting peripheral blood from our vasculitis and myositis patients. We have probably right now one of the largest biorepositories across all different rheumatic diseases. And the goal to use this biorepository is, again, for precision medicine. How do we now target a certain therapeutic for an individualized patient?